My name is Ben. Like I mentioned, I have my bachelor's degree in sociology from UC San Diego, and I'm a health educator and an HIV tester counselor. So this presentation will sort of go through these objectives. We are going to start the presentation with understanding HIV, understanding differences between HIV and AIDS, the fluids that transmit HIV, what an exposure to HIV is versus an infection. After this, we will define health disparities. So what are health disparities? I'll give you some examples of health disparities, and then we're going to examine the relationship between health disparities and HIV, explore why these health disparities exist. Then we will talk about biomedical prevention. So what is being used, what tools are available, what medication exists now to either prevent HIV or to treat HIV for folks who are HIV positive. And then I'm going to conclude this presentation with a general overview of Manistat Human Services, services that we offer regularly and services that we are offering during the COVID-19 crisis. So let's start off with understanding HIV. So this is a very general overview of HIV. HIV is the human immunodeficiency virus, and it's the virus that causes AIDS. So HIV targets T cells or white blood cells, which are responsible for defending the body when an infection occurs. It's the body's immune system cells. AIDS, on the other hand, is acquired immunodeficiency syndrome. There are certain requirements that are included for a person to be diagnosed with AIDS, and this includes a person has to have less than 200 T cells and an opportunistic disease develop, and have a diagnosis from a doctor to now be a person living with AIDS versus a person living with HIV. So how I understand the difference between the two is that HIV targets the white blood cells, so it's what's happening to your cells, and AIDS is what is happening to your body. So after HIV has done what it has to do, and if it goes untreated, then your body begins to experience damage through these diseases, and which is now the later stage of HIV, which is AIDS. So it's important to understand how HIV is transmitted. So this includes 6 fluids total, which are blood, pre-cum, cum, vaginal fluids, breast milk, and anal fluids. So an exposure means that one or more of those 6 fluids enters your body through an open wound or a mucous membrane. And an infection is when the virus itself has entered a white blood cell and has changed the DNA structure of that cell and is able to replicate in the body. So it's important to understand that an exposure doesn't always lead to an infection, and there are many factors that play a role in that, whether it be the amount of exposure that you had. It could also be your immune system, how strong it is, right? How healthy of a person you are. Those are some of the factors that are included in this. It's also important to note that a person can be living with HIV and not show symptoms for up to 10 years. So you could be HIV positive and not know it, and be engaging in behaviors that are putting others at risk, right? So the only way to know your HIV status is by taking an HIV antibody test, or a test that draws blood and that looks for the virus itself. Either tests are relatively accurate. Now we're going to talk about health disparities and sort of define these to give us a better understanding. So this slide is titled Using Conflict Theory to Define Health Disparities. So like I mentioned earlier, I have my bachelor's in sociology, so I'm a sociologist by training. One of the theories that I use to really understand and analyze society is conflict theory. It's a sociological theory established by Karl Marx to explain class struggles between the proletariat, working class, and the bourgeoisie, the wealthy, the elite. And it's typically understood as a struggle for resources. So one group has control of those resources, and the other group is fighting to get some of those resources, right? So it's a struggle between two groups in society. So really, conflict theory can be expanded to explore racism and sexism in our society. So how the patriarchy perpetuates oppression and violence onto bodies not deemed masculine. And then you have anti-Black racism in the United States and globally, right? How our societies are structured to perpetuate and inflict oppressive and violent systems onto Black folks or the Black community. In regards to this presentation, health disparities are defined as a barrier that prevents an individual or community from accessing quality health or achieving a healthy lifestyle. So an example of this includes urbanization policies, which could lead to the formation of urban ghettos. So gentrification, pushing working class people out, or having them not be able to like pay their rent. So then that leads to homelessness. It could lead to homelessness, right? Then we have criminalization, so mass incarceration, which disproportionately targets Black men. So what does a criminal record do to a person? And then environmental racism, meaning if you live next to highways, what are the chances of you developing asthma as a result? Or also to, if you live in certain communities where there is no grocery stores or places that sell quality foods, like what does that do to your health, right? To continue on to get a better idea of what health disparities look like, we have factors here: socioeconomic status, education level, geography, sexual minorities, and food deserts. And then we have outcomes. So socioeconomic status, if you're stressing to pay rent, that's gonna perhaps lead to anxiety, which could then lead to other health issues. If you are a sexual minority, perhaps you are someone who was kicked out of your home for being queer, and then you're forced to survive somehow. So you engage in sex work for survival. And in the place that you are doing sex work, there are high rates of syphilis, chlamydia. You will most likely develop or have an STD, right? And food deserts, not being able to access quality food, can lead to heart disease and obesity. So this slide is intended to sort of give you a better understanding of what health disparities look like. Now we're going to explore the relationship between health disparities and HIV. So this bar graph is essentially comparing HIV infection rates from 2010 and 2016. What we're seeing is that the Black community is hit the hardest by HIV, specifically African American gay and bisexual men. They have the highest rates of HIV infection. However, the rates have plateaued from 2010 to 2016, meaning we're not seeing any more HIV infection rates. This changes when we look at Latino, gay, and bisexual men. We see that there has been an increase in HIV in that community specifically. It's also important to note that Black straight women also have the highest rates of HIV infection amongst the heterosexual community. So when analyzing HIV infection rates, it's important to use an intersectional lens to really examine this holistically, right? Because it's easy to sort of just focus on men who have sex with men and neglect the needs of Black straight women who are also being impacted. Next, we're going to look at more charts that display HIV infection rates amongst the trans community. Similar patterns here. We're seeing Black trans women, Black trans men have the highest rates of HIV infection, followed by Latina trans women and Latino trans men as well. So to offer sort of an explanation as to why these health disparities exist, I have this sort of formula here. So we have structural and cultural forces at play that influence a person's behavior. So, what structural forces are at play that make it challenging for communities to prevent HIV transmission? So policies, right? Gentrification, criminalization leads to homelessness, sex work, not being able to access medication, your sexual geography. Then we have cultural forces, right? So beliefs and ideas that determine a person's health outcome. So maybe I don't like going to the doctor or going to the doctor because I don't believe that, or I don't trust my medical provider, right? That will lead to poor health outcomes. Um, you have homophobia and transphobia, HIV stigma. So both of these forces are at play and then influence a person's behavior. So I'm going to engage in sex work because I cannot access a job and I need to survive somehow. And this here is talking about biomedical prevention. So we have pre-exposure prophylaxis, which is a pill taken every day to prevent HIV transmission. And if you're not on PrEP and you're exposed to HIV, you can take PEP within 3 days to prevent the exposure from developing into an infection. Another tactic is harm reduction, so minimizing exposure to six fluids. So if you are someone who injects drugs, making sure you're accessing syringe exchange programs. And then for folks living with HIV, making sure you get into medical care, adhere to your medical treatment so that you can reach a level considered undetectable, meaning the viral load is so low in your blood that you cannot transmit HIV. And here at BNSF Human Services, we are working diligently to address these disparities that exist. We're a nonprofit that was founded in 1989 as a result of the AIDS epidemic. And some of the services we offer are free HIV testing, free STI testing, and HIV education programs for both gay, bisexual men who have sex with men and trans Latina women. I know things are a little sort of rocky right now as a result of the COVID-19 crisis. So if you need to reach out, that's my contact information. And these are services specific during this time. So we are still committed to the well-being of our community. And here are the services that are being offered remotely. Support groups for Spanish-speaking gay, bisexual, Latinx men, as well as individual counseling sessions for gay, bisexual, Latinx men are being had through Zoom. So if you're interested in participating, you can email me. My email is listed there. I am facilitating these virtual chat rooms, so I'd be more than happy to help you in the process. And for more sort of recent updates, you can follow us on Instagram, and that's where we will be updating, giving updates as to what is happening perhaps with us at our agency, but also maybe in general. Thank you so much for joining me for this educational video. I hope that you enjoyed it and you learned something new. Again, please do not hesitate to reach out, and I will see you guys soon. Let me just stop this.